We'll move on now to our next segment. And it is my tremendous honor and pleasure to now introduce Dr. Soumya Swaminathan. She is the chairperson of the MS Swaminathan Research Foundation. She's joining us, I believe, from Dar es Salaam. And she's also the former chief scientist of the World Health Organization. In diaspora, I had the pleasure of working with Soumya. Well, pleasure is perhaps not the appropriate choice of word, although it was an honor to work with you, Soumya, during COVID, during the height of COVID, when the world so desperately needed your expertise and your organization's leadership. And I recall several frantic and tense conversations where we were trying to do work together. It's just such a privilege to welcome you back to our event here virtually today, Soumya. And the floor is yours for your keynote remarks.
Thank you. Thank you so much, Sanjeev and MR and in diaspora. I've been listening to the excellent talks that came just before. The title of my talk today is that the climate crisis is not gender neutral. And I want to make the case, and I think probably everybody on this call probably already guesses that women are disproportionately impacted compared to men when it comes to climate impacts. But before that, the World Economic Forum's Global Risks Report of 2023 identified in the top 10 risks, there were 5 environmental risks. But if you look at their 10-year horizon, then 7 out of the 10 risks that they foresee are environmental in nature, biodiversity loss, natural disasters, failure to mitigate, as well as failure to adapt to climate change and large-scale environmental damage. Now, I'm not going to repeat a lot of the basic facts that we already know, but it's quite looking at what happened in 2023, which was the first year that we actually got to the 1.5 degree warming limit that the world had said in Paris that we would try not to cross. I think we had the greatest number of and scale of natural disasters all around the world with floods, droughts, wildfires, etc. And it's clear that the hazards, the climatic hazards to people's health and well-being are only increasing day by day, and that while it's impacting people all over the world, clearly those who are already at the margins cannot take these shocks. And it's the same thing in COVID. You mentioned, Sanjeev, that countries and people who are better resourced are able to bounce back from the shocks. Whereas if you're on the edge, then it's very difficult to bounce back. And it may be that one final push and then you're back down into poverty, as well as food deprivation, which is what's predicted. Now, in terms of the impacts on health, we know it can have direct impacts like temperature extremes and floods, droughts, windstorms, wildfires, and very importantly, ambient air pollution. And then on the indirect side, of course, through the food system, through declining yields, through declining micronutrients in crops, impacting nutrition, impacting water systems as well. We know groundwater is getting depleted in many parts of the world, an increase in vector-borne diseases, malaria and dengue spreading into areas which, where the mosquitoes could not previously survive. And essentially, again, just like COVID, climate is exacerbating social determinants and inequities. Now, in what ways are women worse off? Partly it's because, again, of the intersectionality. It's not that all women are worse off, but when their gender intersects with poverty, with cultural norms, with the kind of roles and responsibilities that women have to cook and feed the family, etc., then you find that the burden is definitely disproportionately higher on them. Now, according to the UNDP, women and children are 14 times more likely than men to die in a disaster. When there's crop failure, there's food insecurity. Again, it's women's job to feed their families. They have to go out and do something to feed their children. There's more agricultural work as men migrate, leaving women to take care of the fields at home. Again, women provide water for the households. And so with water scarcity, women have to probably walk longer distances to look for that water. Whenever there are natural disasters or conflicts, we know that there is increased violence against women. And there's a lot of data now that when areas are subject to recurrent droughts, that intimate partner violence increases significantly. With more time spent on things like providing for food and water for the households, there's less time for women to take care of themselves, or to access healthcare, or in fact, in their caregiving responsibilities. Again, a large part of the world still does not have clean energy for household needs like cooking and heating. And again, it's women who go out to collect firewood and biomass. And not only do they spend a lot of time collecting it, but then it also impacts their health because they're inhaling the fumes. And so women are face double the burden of pollution, indoor air pollution because of biomass, and outdoor air pollution or ambient air pollution, which is, of course, impacting everybody. And again, displacement, forced migration, that also increases women's vulnerability. Now, in a review of 130 studies globally that was done by Nithya Rao et al., 2/3 of these studies showed that women and girls face disproportionately higher health risks due to climate change, whether it's food insecurity, whether it's death and injury from extreme weather, whether it is mental illness, and of course, reproductive and maternal health issues. Now, we could talk about the impacts of heat waves. And recently there was a study that came out of South India, which showed that exposure to high heat, especially when women are also physically working outdoors, does result in a higher risk of abortions, of stillbirths, and of premature birth and babies being born too small, and also an impact on the woman's health in terms of increased risk of preeclampsia, which is high blood pressure during pregnancy. Again, we know that young children and older people, so older women, are much more vulnerable to heat stress, and particularly when these are low-income families living in urban areas with the urban heat island effect. And the Met Department has been actually putting out warnings for India as well as the whole of South Asia that this year we're likely to have very prolonged heat. And when you combine heat with humidity, then what's called the wet bulb temperatures, if they go above 30, and certainly if they go above 35 degrees, then this is kind of incompatible with life. So there are many places in the world, and particularly sub-Saharan Africa and South Asia, where the temperatures and humidity combination is already reaching a point where it's threatening to lives. And so again, we still understanding what the biology is, but there's a terrific strain on cardiovascular system, for example. And if it's prolonged and there's no relief, like if you can't afford air conditioning so that your body doesn't get a chance to cool down at night, then we could start seeing much higher mortality as well. So the implications on women's health go all the way from birth, sexual maturation. It's believed that girls attain early menarche. Infertility is higher. We talked about the pregnancy complications. There are changes in milk composition for lactating women. And then there's also changes during menopause, like early menopause and so on. And again, as I mentioned, if there's intersectionality of poverty or of being a woman from an indigenous or a tribal community, then all of these risks and threats are heightened. Now, I want to turn to not looking at women as just victims and talking about, this is what is happening to women, and unfortunately, this is it. But really looking to turn that around into how women can actually be agents of change, because we know that women are first-line responders, whether it's the mother in the household or whether it's a community health worker, these are invariably women, and they are the ones who actually do all of the work. We saw during COVID, for example, the people who went out, did the vaccination without really thinking about their own health, were community health workers, what are called ashas in India, and village health nurses, and so on. So we have to start looking to see if women are the first responders, then how do we equip them? And how can we make policy? And how do we get the resources and the support for women to be able to understand what's happening, to be able to track in their very communities what is happening? That's what, will be really focusing on adaptation. And I think it was mentioned earlier that a lot of the funding, as it is, there's inadequate funding going into this area, but most of the funding so far has been on mitigation, on the energy transition, and so on transport, and thinking about those things rather than adaptation. And it's already too late. So we really need to make sure that there's funding that goes into adaptation, but also there's a lack of gender sensitivity in our plans. We need to look at policy, and I just want to make a few points maybe to conclude, and then we could open it up for discussion. But the first thing is that a lot of the policy making does not involve women. It doesn't involve community-based organizations. It doesn't involve grassroots organizations. And therefore, it's quite gender blind, really. We really need to start thinking about the different forms of discrimination that are experienced by women. And that's the only way we could include a broad range of human rights and gender considerations as we're trying to build climate resilience. Secondly, we have to ensure that full, equal, and meaningful participation of women, and with diverse backgrounds, both in disaster risk reduction and in climate change mitigation and adaptation. In fact, an example is the representation at COP, country delegations, how many of them are really women. We need to look at things like women's rights to land, natural and financial resources, have decisive measures related to climate-induced displacement, and address and prevent sexual and gender-based violence in the context of climate change. Again, we need to look to make sure that all relevant bodies and processes, whether it's under the UNFCCC or whether it's under disaster risk reduction, they must ensure gender responsive mitigation and adaptation. And we need disaggregated data collection. This is a problem in many countries, and we don't have disaggregated data collection coming from different departments and ministries. It's very hard to make the case or to have the evidence of how women or men are being impacted differently. So we need to have gender specific indicators, and we need to do more research really looking at the effects of climate change upon women, men, girls, boys, poor, rural, remote communities, people with disabilities, LGBTQI, etc. We need more community-based vulnerability and capacity assessments, and conduct gender assessment needs pre and post disasters. And finally, when it comes to policy, then I think we need to look at or review all our current policies. For example, in India, we have a national action plan on climate change, and every state has a state action plan on climate change. And when we've looked at these plans, we find that there are very few of them that are even what could be called gender sensitive or gender responsive. And where we really want them to be is gender transformational. So this could be done only if we have gender focal points in climate and disaster ministries and agencies that have some specific gender training and are tasked, with gender mainstreaming. So we need a lot of capacity building, especially for these groups that make these policies and plans. Of course, we know that the response here needs to be multi-sectoral, so it has to be an all-of-government response. It can't be done by one or two ministries. We need a more capacity building and training at different levels. And as I mentioned, particularly at the community level, I think we have women's groups now that are really active and are quite empowered, and they could be used, or they could be given the further tools and resources needed so that they can take care of their own communities.